have a program here in FB Hospital, and it's called Cheering Towards Zero Harm. And we are adopting basically the patient safety movement aim of zero harm day. In fact, we celebrated not just a day but a week, is to make sure that the staff are well educated with regards to preventing harm, not only hospital-acquired infections such as COVID, but the most common causes of harm. And this is a hospital-wide project that we are implementing in FB Hospital. It's called Gearing Towards Zero Harm. And therefore, we're not just focusing on infectious disease as as a project, but the whole gamut of preventable medical errors that are happening. So in short, we are working towards Zero Harm campaign. Definitely, it's very closely related. Why? No, because if your staff are not safe, how can they serve well? For example, staff are getting sick, how can you serve the patient? So it's directly related. So it starts from home. No, we take care of ourselves, our staff, so that they can take care of our patient. In FB, we have this program, we call it I Love FB, which is a work-life balance, because we engage them in different activities, not only learning, fun learning, but also, for them to have, engage in a hobby that will eventually, make them relax and be able to focus in their work afterwards. By educating them and telling them, you have these policies and protocols on how to prevent the harm to you as a healthcare provider, to our staff, then you're already empowering them to be safe. And therefore, when the staff are safe, they can serve well, as I always say. We must take care of you, so that you can take care of our patient. Well, as I said, improvement is always very dynamic. We already have some automation of processes like the incident reporting system, the risk management system, but we want to develop further to include others, data analytics that we need to know. We are always comparing ourselves to aviation industry, because aviation, the healthcare is being compared to aviation. And actually, we adopted some of the aviation practices. We have checklists now. We have to do something before we do the procedure. And similarly, that's have been happening in the aviation. But what's lacking? Regardless we are adopting all these checklists, the number of preventable medical errors are still so much. And so what's the difference between aviation and healthcare? There's no patient safety board like what they have in aviation safety board. Of course, if you have a very well-defined, evidence-based internal processes, that will lead to good care also of the patient. And when your patients are very satisfied with the services that you provide, you will have the financial benefits now. Because if you cut costs, yes, you save now, but do you think you will save your future? I don't think so. So in short, you have to always take care of your staff for you to be financially sustainable. I was a medical director of a JCI accredited hospital, and one time a very good friend of mine was also a medical director but this time he is a medical director of a provincial hospital in the Philippines. And so you know the discrepancy between a private hospital, well-funded hospital, and a government hospital. Unfortunately, and he came to me and said, I have a problem. I have a big issue in my hospital. A patient died, a child died in front of the parents because apparently the practice in my hospital is to use a syringe, even for oral medication, because they can measure it well and it's easy to give it to the child. No? But there was a serious mistake. And a nurse gave an oral medication intravenously. The child instantaneously had a seizure and died in front of the parents. And of course, the staff was also so frightened. So in short, in this story, you can see the discrepancy. It was like an epiphany for me. Why? It's not patient safety. It's not available all throughout the world. Including those who cannot avail accreditation. And I think this should be like the foremost responsibility and accountability of all healthcare organizations. Make it safe.